Good morning, everyone, and thank you for inviting me to speak at the Ophthalmological Society of Kenya Congress 2020. My best wishes to everyone and hope that you're all staying safe and well. My name is Victoria Liu, and I'll be presenting today on the evaluation of leadership skills development through the Sandwich Glaucoma Fellowship. A special thanks to Dr. Kareem F. Damji and Rita Whitford from the University of Alberta for all of their help with this project. And thank you also to so many previous Sandwich Glaucoma Fellows who participated in the program and contributed to collecting the data and some of the review. I have no financial disclosures or conflicts of interest. Today we'll be discussing an evaluation of the leadership skills developed through the Sandwich Glaucoma Fellowship, and we'll begin by going over a short description of the fellowship, a description of our study, some key results, and what we've learned. So the Sandwich Glaucoma Fellowship, some of you may know, uses a unique sandwich design in which a fellow trains between the developed world and the developing world institution or their home institution. The fellowship was piloted in 2007-2008 at the University of Ottawa, and in later years and currently at the University of Alberta. The goals of the fellowship focus on building capacity, a mutual exchange of knowledge and skills, an innovative approach to subspecialty development, and training individuals in leadership and glaucoma management so that their academic institutions in the developing world can be brought into the future. So the program includes 5 rotations between the fellow's home country and the developed world institution. And these rotations focus on assessing the institutional capacity at the home institution while building relevant knowledge and skills in a layered sandwich design. One key component of the fellowship is leadership training. And leadership and training is important in the skill set of physician, and it's the topic of focus in Canada and medical education. However, in the international context, leadership is also necessary to tackle health system challenges. The fellowship includes so many components, but this evaluation specifically is focused on leadership skills development. This study was a retrospective mixed methods evaluation, and fellows from the Sandwich Glaucoma Fellowship, or those who experienced similar fellowship training with leadership mentorship between 2007 and 2019, were contacted to participate. Out of 9 fellows, 7 responded to a survey that was aimed at investigating leadership skills through a series of 20 questions and 18 Likert scale sub-questions regarding specific leadership abilities and improvements. The data was separated into 118 fragments, and an open coding technique for content analysis was performed using 2 raters. So here we have some key demographic data that was a product of the survey. And it found that the mean number of years since the Sandwich Glaucoma Fellowship was approximately 6.1. Most of the respondents trained in Kenya and Ethiopia, although their home country differs. Fellows were also asked to rate the impact of the fellowship on various leadership competencies, and here I've displayed quite a few on my slide. And they were asked to rate on a 10-point scale, with 10 being the most positive impact. And so you can see here that many competencies had a positive change, including integrity, 8.8, work ethic, 8.64, and empathy, 8.6. Open coding content analysis also uncovered many key themes in the participant responses. These included the additional training or desire to train, informal leadership training, the lack of formal leadership training, future improvements and suggestions, ongoing professional contacts and collaborations, and barriers to providing their leadership skills or their glaucoma management strategies within their institutions. The most frequent discussed included the evolution of the leader role and specific skills and components of the fellowship. Due to the fellowship, 6 of 7 respondents found that they had a change in their professional title, a positive change. The one individual who didn't know a positive change found that they improved within their role, but they already had a high position. However, a limitation of our study is that the knowledge acquisition relating to glaucoma management is actually a confounding factor that may lead to the ascent in position. So we can't entirely attribute the ascent in position to leadership capabilities through the fellowship. And previous fellows or those with similar training found that they were working with other glaucoma specialists to train ophthalmologists to provide better glaucoma services, or they were mentoring residents in a more interactive way and putting their interest at the center. Many skills and components of leadership training were identified through the survey pertaining to leadership skills. Participants specifically commented on skills that they found developed, including communication skills, negotiating skills, partnering with industries and funding agencies, and the ability to work in a team and develop healthy relationships. It was noted in the survey that there were some major assets to the fellowship program in terms of leadership training, and these were informal leadership training and ongoing professional contacts and collaborations. Through the fellowship, fellows gained exposure to leadership and management practices and formed relationships with their supervisors and their mentors to provide ongoing support that some of them still use today. The ability of local mentorship and continued mentorship connections was also found by another author, Kimball et al., in a similar fellowship design to increase the ability to retain leaders and to offer a promising future for the countries that it involved. So we hope that our mentorship and informal training within the fellowship will be preserved in the future of the fellowship program. Fellows also stated the following. They said, I have been exposed to leadership and management of glaucoma in academic and community practice setting, where I have seen different leadership styles and worked as a team with colleagues, other medical and non-medical staff. And also the most useful in terms of my fellowship training is the ongoing coaching and mentoring with my supervisors with several visits at my workplace. The ongoing mentorship is valuable. Despite some of the strengths fellows indicated, the fellowship also lacked some formal leadership training, and many suggested that it can be improved by including lectures, specific learning objectives catered to each fellow, and other opportunities for exchange programs to learn from various other institutions, and to focus more on leadership development from varying styles. But overall, we can say that the fellowship had a positive impact on leadership skills and professional development, leading to positive changes in fellows' positions, increased mentorship and training roles at their institution, and acquiring new leadership competencies. Although goals of the fellowship were met, there's still a lot of room for improvement. Including a formal curriculum and learning objectives is something that can help fellows reflect on and monitor some of the skills that they're acquiring, and also allows them to discuss with their mentors and colleagues about some of the things that they hope to achieve. Thus, learning objectives were created and hope to be implemented for new iterations of the fellowship. One thing that we wanted to strongly suggest, though, is that these learning objectives should be made personally for the fellows and catered to their own needs, and they should be formed in collaboration with some of the fellows. And this is because during the fellowship, they may want to work on different things, including glaucoma management. Some may have different objectives for leadership skills that they want to learn and more. So I apologize, there's a lot of words on this chart, but these are some of the objectives that we've worked with some of the fellows to form into this chart to be able to be implemented into the fellowship. So by the end of the Sandwich Glaucoma Fellowship, fellows should be able to evaluate existing glaucoma care within their home country and participate in activities that contribute to the effectiveness of healthcare organizations and systems in order to optimize delivery of quality glaucoma care. Allocate finite healthcare resources appropriately. Fellows should familiarize themselves with the system's approach to healthcare delivery pertinent to their future practices. They should be able to manage practice and career effectively, understanding personal limitations and the importance of wellness and seeking out support if they need. They should be able to conceptualize and be prepared to deliver high quality educational programs relating to the acquisition of glaucoma skills for residents, fellows, ophthalmology colleagues, and other healthcare members. And they should be prepared to serve in administration and leadership roles as appropriate. So in conclusion, the fellowship focuses on many pillars, including building capacity, a mutual exchange of knowledge and skills between the developing and developed world country, an innovative approach to subspecialty development, and training individuals in leadership and glaucoma. The fellowship is effective in supporting leaders in countries in sub-Saharan Africa in the management of glaucoma, and specific aspects including informal leadership training and mentorship was valued, although more formal leadership training and learning objectives catered to each individual are needed. And lastly, other programs can use a similar model to promote the development of skills to create healthcare leaders. Thank you so much for allowing me to present today, and best wishes to everyone.